how can we provide you with good patient experience? How can we, referring provider, provide you the best continuum of care for your patients? And we do that through understanding what their needs are, what our competitors are doing, so we know how to do that better. And then the key is gathering that information and then putting it in consumable packages, if you will, for specific stakeholders within the organization.
Hello, healthcare. We're excited to be on the floor at HMPS 2021. I know that not everybody could make it here, not everybody could meet in person, but fortunately we're bringing a little bit of that HMPS experience to you, especially if you want to relive a few moments. One very important topic that we were just discussing with Laurel Hopkins, who is the manager of physician relations at Seattle Children's, is on the intelligence that we can gather from the outreach that we're doing to our physicians. There's a ton of intelligence, there's a ton of opportunity to gain intelligence that we have in our physician liaison teams. And what can that intelligence inform us? All kinds of things, from strategic decisions to things that make our physicians' lives better and help to do things like retain their efforts and referrals and reduce burnout. So with that, Laurel just wanted to give you an opportunity to say hello.
Hello, it's good to meet you, and thank you for having me today.
Excellent, excited to meet you too. I think we've had a very lively conversation already, and I'm just so happy to bring YouTube and everybody else into the fold of this, because there just is so much kind of like potential energy, latent opportunity out there. Could you just tell us some background? Laurel's been with Seattle Children's in provider relations for the past 9 years and in healthcare for 25. And there's a lot of unique perspectives here that we're going to uncover when it comes to this field intelligence within the physician liaison space. Yeah. Could you just give us some background on your experience and your journey here and what's made you hot on this topic?
Yeah, so it's interesting because the topic of field intelligence has become all the rage lately, if you will, because we've been in this pandemic. Pandemic, but it's really, it's really caused a disruption in how we approach customers, how we are interacting with customers, but for everybody's bottom line, we're looking at some statistics that we've heard at HMPS today are like healthcare systems are losing to the tune of $56 million. And, that's a lot of money to the bottom line for health systems. And our sales force, the dirty word is sales force. Physician liaisons are really out in the field trying to figure out how to position ourselves, our systems within our competitive landscape, which changes tremendously. It's changed tremendously over the last 5 years. Then add this new situation of a pandemic that we're in, and then couple that with the money that's being lost. Our senior leaders and people are getting really worried about what we're going to do next. So that's kind of the journey of the last 18 months, the last 2 years. But the thing is we've been doing this all along. Gathering field intelligence, understanding how to show up and say, you need me versus, or let me rephrase that. How can we provide you with good patient experience? How can we, referring provider, provide you the best continuum of care for your patients? And we do that through understanding what their needs are, what our competitors are doing, so we know how to do that better. And then the key is gathering that information and then putting it in consumable packages, if you will, for specific stakeholders within the organization.
That's really powerful when you mention the recent stakeholder interest. Actually, I want to back up just a little bit. You mentioned field intelligence is a hot topic right now, whereas I would have considered it with the intelligence I've seen from physician liaison teams. I've always wondered about how to get that, how to bubble that information up into strategic objectives.
Mhm.
What is this way of packaging that you're referring to?
It's really that's the fun thing about being. You talk about all the energy and being in person right now. It's the fun thing about being face to face with my peers again. Is like, hey, field intelligence. Everybody wants, so and so leader will come to you and say, I need to know what this customer is doing now. And you have to be able to turn, they don't want to wait 3 weeks till you say, oh, let me go out and get it. I'll figure it out. I'll ask a few people. They want it now. And so there's two things going on there. One, we have to be ready to rock and roll for that particular instance. And then two, as kind of that middle management group, we need to help our senior leaders who are really kind of dealing in this chaos right now, how to help them kind of slow their roll and say, you know what, we're going to do this right. And we're going to do this in a way that is sustainable for us. So when we talk about how we take that field intelligence, we've had it forever. And what can we do to package it from a consumable perspective in terms of consumable for whoever's asking for it? So to your question, how do we do that? We do that via having specific reports that we're using. PRMs, CRMs are great tools that we're equipping our teams with right now to be able to collect that data. And not only do we collect it, using these types of tools and resources allow us to slice and dice the data to say what needs to be said at a specific time. When we have that data, it does help inform decisions and strategies, where we want to show up and how we want to show up.
So when it comes to this packaging, then do you have an example of maybe like a report or way that you delivered it, or had a team deliver it to a senior leader that, like you said, let's make it consumable?
Mm-hmm.
I wonder, they're asking for this stuff, like once they consume it, do they start changing their directions? I would love to hear a story if there's something to share about that.
Excellent. So let's use an example of we have a market that we were having some feedback, an effect in orthopedics, and all of a sudden things weren't going the way we'd expected them to within an orthopedic department. And the field intelligence that we'd had sitting there for a few years said there was an adult provider. Again, keep in mind, Seattle Children's, standalone children's hospital, there's an adult provider literally right next door to our facility that was all of a sudden seeing some sports medicine cases for older adolescent patients. They were seeing scoliosis, these things that we just kind of took for granted that would always just come to a children's provider, and a children's meaning a pediatric provider. And the field intelligence was that, hey, there's this provider over here that they are referring, our referral group is referring over to this provider because number one, they can get in. And number two, they don't have the access is much, much easier. So getting in is one thing, but then the whole process of getting in was just much easier. Once we were able to say, this is what's happening in that market and it's affecting us by the variance of this, then we were able to kind of help redeploy in a way that was suitable to address the situation that had happened.
So I love hearing the fact that there was a specific challenge, and the parts that's bothersome is like, hey, we've known this all along, and we've been trying to say it, and there's this recent. It seems like the trust in this data that's already been collected is just now recently kind of bubbling.
Exactly. And then you keep coming back to, and what does that look like? So back to that whole being able to answer that question of consuming the data in a way that is meaningful to the question how it was asked. We've got very, very high level, like it's archaic, but it works. A big spreadsheet that will have who are those competitors, what the market that they compete in, and all the way across for service lines. And it's literally just an X here. So if somebody's like at a glance in this market, who's offering what services that actually compete with us? They can look at this, and then there's some notes too. They can look at that and say, okay, that's at a glance. Then we have another piece of data that backs up that data That's basically a SWOT analysis. There are a
Mhm.
couple slides and these things, that's the other thing, is these are constantly changing. Anytime we get new pieces of information, we're going in and updating these pieces. Then the other thing, so then you've got that. So you've got at a glance, then you've got the 10,000 foot overview. And then if you want to get really granular, then we go into our PRM and then we can slice and dice the data and it can say this provider said this in this market. So however they want to be able to see that, we can package it up. I try and keep it to those 3 pieces to make it consistent.
Mhm.
And that's the other thing, consistency. You don't want your field intelligence to make it relevant and to have it bubble up. You want to always have it be relevant, be able to have it consistent. So if, one service line asks, well, they gave us this data, we can say, yes, we gave orthopedics the same data. It's all from the same data set. So there's that.
Yeah, absolutely important is, like no cherry picking.
No cherry picking. Yeah. It's got to be the good, the bad, and the ugly.
Yes.
Right?
Love it. Especially like if we're open to hearing about the ugly, if we're like, look, the good, the bad, and the ugly, then it's not just, hey, how do we make ourselves look good and important? It's how do we course correct based on things that might not have worked out as well as we thought.
Yeah. And then using those course corrections. Here's the other thing is being able to use those course corrections where we might have missed the mark and learning from that. Is like when the same thing starts to happen in another market, like let's just say for example, like what we saw in that one market with the adult provider taking business from our older adolescent population. If we can start to see the signs of that, we've used that experience. We're not going to miss the mark next time on that. We're going to know that there's a dip in performance. There's a dip in whatever market metric we're looking at and say, oh, is this the same thing that's happening? Let's go back to our field intelligence to look. So
has this newfound trust in field intelligence, the questions that you're getting from leaders, which I'm sure there's all kinds of different questions and they want answers now, has that had an impact on how when we're training our physician liaison team or preparing for physician outreach, has it impacted the types of questions that you go out and seek?
Yes, it does. Well, it does. It's a good question. I was going to say yes, but then there's part of me that's like, no, we're just asking because the liaisons really are at the granular level. They're really wanting to make sure that number one, the patients that the referring provider are working with are really going to get the best care. And of course, we're liaisons for that organization, so we think our care is the best. So when we hear, no, we didn't refer for that, we've always trained our liaisons to ask why. Mm-hmm. And why didn't you? Where did we miss the mark? We understand what drivers of choice are for our referring providers from market research that we did. And so if we couple that with field intelligence, it's like then we can figure out how to craft a message, deliver a message that's the right message at the right time to the right people that will ultimately affect our strategy and our growth.
Excellent. So I guess my question was kind of predicated on like if like I've talked with a lot of different teams that have different types of questions they ask, but it seems like there's a really good process in place already to say if we're learning something, like if a piece of bad news comes up, we're not burying it, we're asking why something happened. So I think it's a really powerful way of looking at it. Mm-hmm. But one thing that comes to mind though, and I don't know exactly how engaged leaders are after they're presented with the data, but I'm wondering, do there tend to be any kind of additional steps, or are the leaders are they now pretty strongly listening to this field intelligence that you're bringing to them?
They're for sure strongly listening now, just because we've been hit with the pandemic. But there's, as in any organization, and there's a great consultant firm here called Barlow McCarthy. Mm-hmm. Chris Barlow just put out a brand new book about physician relations and the structure. And one of the things that I've taken out of that is there are people in the organization that absolutely get physician relations. There are people that don't. Mm-hmm. And the people that get it are the people who are always going to listen to you. And those are the people, just like in anything, you want to champion them to say, you are my partner And you need to help me champion and get this information to the right people at the right time. The thing is with physician relations, and we did a hilarious conversation here just earlier, is like, I challenge anybody to say, what department in a healthcare organization does physician relations not touch? And nobody could think of anything. I mean, nobody could really think of anything because we have that many stakeholders within our organizations. And so it's just getting people, champion those people to help you become that enterprise asset, but then also always delivering credible, relevant, timely, and trustworthy information is the other thing too.
Absolutely love it. Having a champion is so powerful. When it comes to a lot of these challenges around data storytelling that we're encountering, it's not necessarily like the types of charts that you use or whether or not you're using a powerful BI tool or whatever. It's about, did you have a relationship at that leadership level with one, like you're kind of going one-on-one with somebody, and then they're kind of shepherding you into the rest of where you need to make influence with the team.
Exactly.
Cool.
Yeah.
Well, I love the foundation of that process, and that hopefully for folks that aren't doing this already and that don't have the executive ear on that field intelligence, hopefully that they're able to listen to that and gather more insights on what they could be doing.
And the other thing is that as we're talking about that, you need to make sure that you're having a consistent dissemination of information, whether it's on a quarterly basis, whether it's on a monthly basis, weekly basis. At Seattle Children's, we have 3, and I think this, aside from the champion, this also plays into our favor as well. And I think why we've been so successful is we have a physician relations advisory group that meets on a quarterly basis. Key stakeholders in the organization are in that advisory group, and we talk through field intelligence and how that's shaping and informing how we're moving forward with our strategies. It also allows us to get their inputs. Like, this is what we're hearing in the field. This is what our competitors are doing. How do you think that you would want us to respond to that? Because this is what we've proven. So that's happening on a high level on a quarterly basis. On a monthly basis, we disseminate a report. It's kind of a one-page dashboard that has the highlights of competitive verbatims, themes and issues that we're hearing. And they're consistently getting hit with this, right? And then from a service line perspective, we have monthly meetings with our specific service lines as well. So there's a consistency to the dissemination of information, which I think is also key. If they're used to it coming to them, they're used to looking at it, and then we get it in their mind of, oh, this is coming to us, and it's valuable. So
fantastic. Yeah, let's not hit people with all of a sudden in a meeting there's some dashboard that I've never seen. And
right. They want to be familiar with it, and they want to know where to go to look for it. That's exactly right.
Fantastic. Well, a lot of our conversations today have kind of gone in this direction. We're talking about an overall strategic issue, but then it becomes a data storytelling question.
Yeah, it absolutely becomes. So you've got that. You have to root everything in data. It's however, you can have data say what you want it to say, right?
Yeah.
So it's this overlaying. The data helps you tell the story. The field intelligence, which I call anecdotalytics. Anecdotalytics plays to that, adds the color to it. And then you've got the people, the liaisons who are out there. I mean, these folks, I've got a really well-seasoned team. They're fantastic. I mean, yes, I'm their manager, but man, I'll do anything to support these people. They're that good at what they do because they've built these relationships with people that are built on trust, integrity, credibility, and respect. And it's almost like they're the bartenders in the world, right? They hear everybody's stories, and there's a lot of value in that. So add those 3 components together, and you've got a really good, solid story to inform a strategy, inform a growth plan, and just inform everybody what's happening within your competitive landscape, which changes all the time.
Well, these are some really powerful examples that you've shared. I've got one kind of wild question that I've been thinking about this whole time, is that there's so much collected, like people are taking notes on their interactions with physicians and things like that. And it makes me wonder, do you see potentially and you could say no to this, but do you see a potential role for AI in helping to sort out that field intelligence?
I don't want to say no because I don't know, but I will tell you what I do want to know is what's possible in that realm, right? I mean, as we get to this point where we're getting busier and busier, everybody with the new Great Resignation that's happening right now, more work is getting piled on to everyone. And so I would want to know what's possible. Because if we don't stop looking at what's possible and what's next to help us be efficient and effective, then we're going to flounder. And everything else is changing so quickly. Healthcare comes at a slower pace, but we need to keep pace with it. And so my answer is I don't know, but I do definitely want to know what's possible.
Cool. Well, immediately, like it depends on the quality of notes and the volume of notes that are coming in. But like, let's say that there's a few thousand notes left every year. And how do we read through that? How do we sort through that? How do we look at trends? There's a field of AI called natural language processing that could be helpful if, a smart team puts something together for that.
Yeah. This is more than a Wordle, isn't it?
But overall, I am so happy to have been able to have this conversation. Laurel, I wish I had been able to see that speech that you gave. So this is just me getting some of the highlights from it. But for all the folks that are looking at this YouTube video and they're like super inspired, they're like, I want to learn more. Laurel's got the answer for me. Is there a good way for them to reach out to you?
Yeah, they can reach out to me via email, and it's just laurel.hopkins@seattlechildrens.org. It's the easiest way to get in touch with me.
All right. Well, I hope that this conversation helps with the physician liaison, physician relations community. I'm really glad that you volunteered your email address so people can talk and get in touch and have these conversations. And with that, thank you for joining us, and hope that everybody has enjoyed this little taste of HMPS 2021.
Likewise, thank you. Thank you very much.
If you want more of the latest from healthcare's thought leaders, subscribe using the button below, or you can visit hellohealthcare.com to get updates directly in your email.